Violence of any kind often leads to an emotional and physical pain that can take years to fully recover from. KSHB 41's Jian Kim talked to a doctor at the University of Kansas Health System about the physiological impact of gun violence.
Mostly young people that we're seeing coming in shot, and it's a tragedy.
Dr. Robert Winfield says the number of gunshot victims have steadily climbed during his time as a trauma surgeon. But one thing has always remained the same: violence doesn't discriminate.
We see gunshot victims of all ages. We see everything from young children through elderly individuals, people who were involved in illegal activities, people who were not, people who sustain unintentional injuries, patients who self-inflicted those injuries.
He says the negative consequences for one member of the community affects us all. Too often, his patients come right back into the hospital. That's why healthcare leaders at the University of Kansas Health System are investing in programs like Revive, a hospital-based violence intervention program that works to address the root causes.
Our team does a wonderful job of reaching out to these folks after their injury, getting not only them but potentially family, siblings, and so forth plugged into these programs, so that again we try and prevent these injuries from either happening again if the person's already been involved, or prevent it from happening in the first place.
KU Health System is also one of only 5 centers in the country to receive a grant from the CDC. It will continue to fund an existing program in Wyandotte County and expand it across the metro.
For me, this is more than about patching up injuries and getting people back out to where they came from. It's really about trying to address the underlying causes.
Jian Kim, KSHB 41 News.